Ask the expert. I want to warn you, this next topic is intended for adults, not for younger audiences like kids. So if they're in the room, you got 3 seconds. Shag them away.
Dr. Jacqueline Paykel from the Medical College of Wisconsin here to talk about intrauterine devices as a contraceptive method. What is an IUD for people who don't know?
So this is a removable device that we put into the uterus. It's put in by a healthcare provider, and it's T-shaped, and it's intended to prevent pregnancy.
So how effective is the IUD compared to other things? You know, you take a pill, you use hormones in some way.
So the failure rate is about 1%, a little bit less than 1% actually, and the pill is about 8%. And so it's much more effective than the pill is. And actually, tubal ligation, which is another common form, has a failure rate of 5% over the years.
So pros and cons, let's lay those out for these devices versus other contraceptives.
Effective, very cost effective too. They're inexpensive as far as contraceptives go throughout the years because they're good for anywhere from 3 to 10, and some would even say Paragard is good for 12 years. And they're easy for women. They don't have a tendency to forget. But the cons, so for instance, for the Paragard, it can cause increased bleeding and cramping with the menses. And as far as the Mirena IUD, it has hormone in it, so it can cause your periods to go away altogether. Some women would worry about that. There's an increased risk for ectopic pregnancy when you have an IUD in as well.
Okay, other complications that are out there. Infection, is that a risk you run if you go this route?
That's a good question because in the 1970s it was a common problem with the Delcon Shield, which was an IUD that was available then. That's no longer available. We don't see an increased risk for infection.
I would think maybe a lot of women would lean toward the one where there's no hormone because then you don't have the risk of blood clots.
Well, sometimes blood clots, the hormones can contribute to blood clots, but many women prefer the non-hormonal IUD simply because of the risk of hormones. However, the Mirena has a progestin in it, which can control heavy bleeding at times, and sometimes if you have very problematic periods, it can make them go away.
That makes a difference, okay.
Which segment of the population is best for this? I mean, if you've already had a pregnancy, if you haven't, I mean, who should look at this most seriously?
Until recently, we thought that it was necessary to have a baby before you had an IUD, but now there's even a special one on the market right now that's smaller that we can put into women that haven't had a pregnancy before.
What about cost? Because I think that is usually what it comes down to.
Well, if it's out of pocket, it can be quite expensive, $500 to $1,200, but insurance generally covers it. So it's very effective over the period of time. If you're keeping it in for anywhere up to 12 years, it's
right. If you do the math, it's really good cost-wise.
That's right.
Is this the most invasive form of birth control that's out there?
No, I don't think so. We have implantables under the skin, and that takes a minor surgical procedure or a procedure in the office to remove them. Can leave scarring, and then there's intramuscular injections. I think that this is a really nice controllable form because you can remove it and fertility returns almost immediately.
Do you think this is going to edge out the pill?
Ooh, that'd be a tough call because, yeah, no, I don't think so because that's very controllable by the person. But I think that it's become, well, it's much more common now to get a Paragard. It's 8% now versus 10 years ago, 5%. So,
right. Dr. Paykel, thank you for coming in this afternoon.
Do you have a question for our experts? Email them, asktheexpert, today's TMJ4.com. You can also leave a voice.